Ever found yourself torn between Tylenol and Motrin when your child is burning up with fever in the middle of the night? By the end of this video, you'll never have that moment of hesitation again. Last week, a mother came to my pharmacy with exactly that problem. Today, I'm going to show you the conversation we had and how she went from confused and worried to confident in choosing the right medication for her child. I'm Pillmuse, a pharmacist bringing you real advice from the pharmacy counter. Let's get started. Last week, a worried mother came to my pharmacy with her feverish child. For privacy, we'll call her child Sarah. Sarah had a fever of 102 degrees Fahrenheit and was miserable. But the bigger problem? Her throat was swollen and painful, and the child wouldn't stop crying. Sarah's mom was holding a bottle of Tylenol in one hand and Motrin in the other.
I don't know which one to give her. Does this make me a bad mom?
You could hear the guilt in her voice. I told her firmly, "No, you're not a bad mom." The problem is that no one has ever explained this properly. The truth is, so many parents struggle with the exact same question. Both are fever reducers, so what's really the difference? Today, I'm going to clear that up once and for all. Let's break down the real differences between these two medications. Children's Tylenol. 3 things to remember. First, Tylenol. When using Tylenol, remember just 3 things. First, age restrictions. For babies under 12 weeks, that's 3 months, you must consult a doctor first. Why? Not because the medication itself is dangerous, but because a fever in such a young infant can be a sign of serious infection. If you just bring down the fever with medication, you might miss something critical that needs immediate medical attention. Second, how it works. Acetaminophen, the active ingredient in Tylenol, does just 2 things: reduces fever and relieves pain. That's it. Simple, right? Third, the most important warning. Tylenol is metabolized by the liver. If you exceed the recommended dose, it can cause serious liver damage. Here's what catches a lot of parents off guard. Many cold and flu medications also contain acetaminophen. So if you're giving both, you could accidentally overdose your child. Never exceed the recommended amount. Children's Motrin or Advil. 3 things to remember. Now, for Motrin. When using Motrin, remember these 3 things. First, age restrictions. Under 6 months is an absolute no. This is a firm guideline from both the FDA and the American Academy of Pediatrics. Why? Because young babies have immature kidney function. Second, how it works. Ibuprofen, the active ingredient in Motrin, does fever reduction and pain relief plus anti-inflammatory action. This is the key difference from Tylenol. It actually reduces inflammation. Third, the crucial warning. Motrin is processed by the kidneys. The big risk. If your child is dehydrated, there's a risk of acute kidney injury. So if your child has been vomiting or has diarrhea and isn't drinking enough fluids, Tylenol is the safer choice. When giving Motrin, adequate hydration is critical. Now, let me ask you a question. What would you give 18-month-old Sarah, who has a fever and a swollen, painful throat? Think about it for a moment. What if we'd given Tylenol? Sure, the fever might have come down temporarily, but the underlying cause, the inflammation in her throat, would still be there, and the child would continue to suffer. This is the uh-oh moment that many parents miss. You can't just treat the fever number. You have to ask, why does my child have a fever? For Sarah, the answer was Motrin. Why? Sarah was well over 6 months old, and most importantly, inflammation was the main problem. Research shows that for inflammatory pain like sore throat, ibuprofen is more effective than acetaminophen. So I told Sarah's mom, for your daughter, Motrin is the better choice. Because it has anti-inflammatory properties, it will bring down the fever and relieve the throat pain that's causing all this discomfort. At this point, you might be thinking,
well, what if I alternate between the two? Wouldn't that work even better?
give Tylenol, then Motrin 3 hours later, then Tylenol again. Honestly, before I became a pharmacist, I thought this was the ultimate hack too. But here's the reality. Yes, in the short term, alternating can bring down a fever faster. The thermometer reading will drop more quickly. But the American Academy of Pediatrics does not routinely recommend alternating doses. Why not? Not because it doesn't work. Because of a critical risk you absolutely need to know about. What is it? The risk of dosing errors. When you're stressed about a sick child, managing 2 different medications with different doses and different timing schedules is really hard.
Wait, did I give Tylenol 3 hours ago or 4 hours ago? Was that last dose Motrin or Tylenol?
In the middle of the night, when you're half awake, it's easy to accidentally give the same medication too soon or calculate the wrong dose. And here's the bigger question. What's our actual goal? The goal of treatment isn't the number on the thermometer, it's making your child comfortable. And there's not enough evidence that alternating actually makes children more comfortable. That's why the AAP recommends.
Start with one medication. Only consider the other if that one isn't working.
Today we covered a lot, but the essentials boil down to this. Promise me just 3 things for your child. First, remember the 6-month rule. No Motrin under 6 months. No Tylenol under 3 months without talking to a doctor. Remember this and you're already halfway there. Second, look for signs of inflammation. Simple fever? Tylenol works fine. Inflammation involved? Motrin is more effective. Swollen throat, earache, swollen gums, these inflammatory symptoms respond better to Motrin. Third, talk to your doctor before alternating. Don't rush to mix medications. Give one medication enough time to work, and only consider alternating if it's truly necessary and your doctor agrees. And the foundation of all of this, dose by weight, not age. The dosing charts on the bottles are organized by age, but proper dosing is actually based on weight. This is especially important if your child is larger or smaller than average for their age. After explaining all of this to Sarah's mom, I gave her 6 essential rules for giving Motrin. First, give it with food. Second, make sure your child drinks plenty of fluids. Third, use the exact weight-based dose. Fourth, stick to the 6-hour interval. Fifth, stop using it if vomiting or diarrhea develops. Sixth, see a doctor if fever persists beyond 3 days. Armed with these principles, Sarah's mom was no longer anxious. She was confident in how to care for her child. The next morning, I got a text from her.
My daughter slept through the night, and so did I without worrying. Thank you so much.
That's exactly it. When you have accurate knowledge, anxiety disappears and confidence takes its place. Now that you've watched this video, the next time your child has a fever, you won't have to hesitate. And one more time, the foundation of everything is dosing by your child's weight, not age. Never forget that. If this video was helpful, please give it a like and subscribe. And share your experiences in the comments. Your stories can really help other parents. I'll keep making videos about the questions I hear every day at the pharmacy. If you have any questions, feel free to leave them in the comments anytime. Wishing you healthy parenting. Thank you. Here's what I always tell my patients. Health isn't everything, but without it, everything is nothing. Subscribe, like, turn on notifications, and keep watching this channel. Every bit of knowledge brings you closer to taking control of your health. And if you'd like to see an alternate version of today's video, featuring different cuts of the visuals used, check out my Patreon. It's all there for curious minds. Just follow the link in the pinned comment.